Hi everyone, I'm going to give you a quick overview of the clinical presentation of diffuse large B-cell lymphoma. Typically, patients present with an enlarging symptomatic mass. Um, it's usually nodal enlargement, neck, abdomen, mediastinum. However, in 40% of cases, it can involve nodal extramedullary tissues, such as the CNS. And um, so the patient case, she's a 64-year-old woman, history of astrocytoma that's been resected. She's received radiotherapy in the 1980s. She also has a history of degenerative disc disease, vertigo, and she presented with 2 weeks of progressive bilateral hip flexor weakness and worsening lower back pain that radiated to her buttocks and right groin, and new onset dysphonia and dysphagia. On physical exam, her vitals have a little bit of elevated blood pressure, but the rest of her vitals are within normal limits. Her physical exam, no lymphadenopathy, abdomen soft non-tender, no hepatosplenomegaly. Neurologically, her cranial nerves and sensation were intact, and her strength in her upper extremities were intact as well. However, in her lower extremities, 3 out of 5 strength in her bilateral hip flexors and knee flexors. Labs that were obtained were within normal limits, and on imaging, her MRI lumbar spine with and without showed enhancing lesions with severe senescence of right L3 and L4 lateral recess and neural foramen, and associated compressive neuropathy in lumbar plexus and femoral nerve. A modified barium sole was obtained, and it showed possible cricopharyngeal bar, esophageal web, and tight upper esophageal sphincter. And an initial lumbar puncture showed lymphocytic pleocytosis, elevated protein, and normal glucose. And cytology showed lymphocytic atypia. So in her clinical course, initially there was concern for disc herniation. She was given an epidural steroid injection, but there was no clinical improvement. They planned for a laminectomy, but later in her hospital stay, her dysphonia and dysphagia just really worsened, and she developed new onset tongue fasciculations that were concerning for autoimmune neuropathy, so the laminectomy had to be canceled. They trialed a pyridostigmine and IVIG, and the response was equivocal. Ultimately, they obtained a repeat lumbar puncture, flow cytometry, and cytology, and that all was consistent with diffuse B-cell lymphoma with CNS involvement, and repeat MRI neuroaxis showed further progression of the disease. The patient was started on Decadron, and PET scan again showed worsening progression, now involving the temporal lobe as well. And so oncology was consulted, and the patient was to start radiation chemotherapy. However, her hospital stay was further complicated by DVTs, PEs, aspiration pneumonia, encephalopathy, and she ultimately ended up in the ICU requiring intubation. So it was a very unfortunate case. So uh, in terms of discussion, so when a patient is presenting with bulbar dysfunction and lower extremity weakness, there's a really, really broad differential. It can include nutritional deficiencies, and in her case, her nutrition panel was normal. Myasthenia gravis, AIDP, CIDP, paraneoplastic syndrome, and infectious causes. And as we know, with her lumbar puncture and flow cytometry and cytology, she did end up having diffuse large B-cell lymphoma that involved the CNS, and that can occur in 5 to 20% of cases. But her presentation was quite uncommon with the dysphonia and dysphagia and bilateral lower extremity weakness. And with DLBCL but CNS involvement, there's really a wide range of symptoms that we've historically seen. It can be subtle, like headaches or local neurological deficits and seizures. So that really makes for a challenging diagnosis. And unfortunately, it's also associated with a really poor prognosis once the CNS is involved, anywhere from 2 to 6 months. So when you have a patient that presents with new onset neurological symptoms, keep the differential broad, and it's really important to obtain CNS imaging and CSF analysis right away so that if a diagnosis of DLBCL is made, radiation chemotherapy can be started immediately. Thank you so much.